KTN News.
Kenya joined the rest of the world in commemorating the World No Tobacco Day. The event was held in Mombasa. Health Principal Secretary in charge of Public Health, Mary Muthoni, said there was need to share with children the dangers of smoking to reduce the rate at which Kenyans are using tobacco.
Hadija Primary School in Mombasa County played host to national commemoration for World No Tobacco Day with the theme protecting children from tobacco industry interference. Speakers called for the protection of the young ones against tobacco use by informing them on the dangers.
Why would you even sell a cigarette to a minor? You could be out of your mind, out of your senses. I wouldn't take you to be a sane person. Among the patients who have diseases that are tobacco related, that is, there is a high risk to get those diseases if you use tobacco.
Over the years, Kenya has made significant strides in reducing smoking, with rates dropping from 22.6% in 2015 to 11.6% in 2022. In 2004, Kenya signed and ratified the World Health Organization Framework Convention on Tobacco Control, or FCTC, demonstrating its dedication to implementing the treaty's provision. The country has since taken concrete steps to enforce tobacco control measures through legislation such as the Tobacco Control Act 2007 and the Tobacco Control Regulations 2014. However, experts say despite these measures, a new generation is getting hooked to tobacco through new ways and devices. These are e-cigarettes, nicotine pouches, and vapes.
There have been reports of trying to step down to electronic cigarettes. But at the end of it all, you have to remember that it's not just the cigarettes, it's actually the content of the cigarettes. The chemical that is in all these cigarettes, whether it's electronic or the conventional cigarette, is nicotine. And nicotine is highly addictive.
According to a report dubbed Hooking the Next Generation by the World Health Organization and a global tobacco industry watchdog called STOP, an estimated 37 million children aged 13 to 15 years use tobacco. And in many countries, the rate of e-cigarette use among adolescents exceeds that of adults.
What is also interesting is when you pick up the habit. It seems that the age of when you start actually has an impact on addiction, and probably that's why these products are marketed to the youth.
The emergence of e-cigarettes and other new tobacco and nicotine products present a new challenge to tobacco control. Studies demonstrate that e-cigarettes use increases chances of conventional cigarette use, particularly among non-smoking youth, by nearly 3 times. Despite the health implications caused by the consumption of tobacco, a number of users are yet to stop, with Dr. Andrew saying that quitting is a choice.
It takes great amounts of will. You can't just wake up and think you'll stop smoking. And that's why, for example, when you're trying to guide our clients and patients to stop smoking, what you call smoking cessation, they actually have to make a decision.
Kenya has had both successes and obstacles to tobacco control. Some of the regulations cover various aspects, including tobacco product packaging, smoke-free environments, and mitigating tobacco industry interference. Miriam Angel, KTN News.